Here's today's 5-minute medical update. Hello again, friends. This is part 3 of my weekend series on coronavirus and the current cultural and shutdown status. I appreciate all the questions, comments, and even criticisms, and I'm going to take 3 of those a week and begin to post a weekly answers video on the weekend, starting on Memorial Day weekend. I want to start today with an in the trenches comment from an experienced Metropolitan MD that I trained with, who's an emergency room physician. When asked his perspective on the current state of the pandemic and the shutdown and reopenings, he stated the following: "I'm sure that if I was an ER doc in one of these newsworthy COVID hospitals, that I would appreciate the death toll more significantly. But here, our people are dying from avoiding the hospital for their chest pain, COPD, strokes, etc. Our daily census in our hospital is down 50%, and I'll comment, as is the case in about 98% of the hospitals in the U.S., including our local health systems." He goes on to say, "But we are seeing people every day that are dying from not treating their routine diseases as they avoid the hospitals, etc. I believe that if we had a daily census on who died from their routine diseases while avoiding the hospitals, we would all be shocked." I appreciate his candor. This is one of the reasons that so many of us in healthcare are confused and even disillusioned by the panic and the unprecedented fear over coronavirus. The excess death rates from COVID-19 appear somewhat minuscule when compared with the total expected deaths for the same period of time annually. And as you'll see in a moment, now even the panic and shutdown fears are starting to harm health, as I had been stating at the end of April to those locally and by Facebook post. So here is the excess death chart published by the CDC this week of excess deaths due to coronavirus. This astonishes me. When you look at this list, you see that the excess death rates when compared with the influenza of just 2 years ago don't really look that impressive. In other words, the excess death rates really are just a bit of a thickening of the normal wintertime excess and springtime excess from viral illnesses in the winter. So, based on my friend's comments and referring back, our utter lack of focus on care and prevention and wellness, going about a normal life wisely, have begun to cause an increase in death rates because we are shut down and scaring our citizens literally to death. We saw nothing like this in 2009 with novel influenza, with far more hospitalizations at 300,000 and 18,000 deaths, which are significant, not as severe as our 80 to 90,000 deaths currently, but 50 times more deaths in children than in our current crisis. And for reasons that I think and many think are evident culturally, politically, and especially related to media coverage. So an associated thought, and one that might cause you to reflect, is in healthcare, think about this. We can't save lives. We might help you prolong the time to death, medically or surgically. We can even help you improve the quality of your life between now and sure death for all of us, no matter what we do. And no matter what we do, the chance of dying is still 1 person out of every 1 people. Think about that. For a further perspective, which I fear we've lost as a country, as well as the filter of education and accurate historical teaching and history itself, I think that the ravages of the polio epidemic in the 1950s are a good example. We saw absolutely no response in comparison to what we see now, purportedly so as to save the kids and the elderly that they contact, as some have commented. I want to read you something from NPR published in October of 2012. And I quote, "60 years ago, polio was the most feared disease in the United States. As the weather warmed up each year, panic over polio intensified. Late summer was dubbed polio season. Public swimming pools were shut down. Movie theaters urged patrons not to sit too close together to avoid spreading the disease. In 1952 alone, nearly 60,000 children were infected with the virus. Thousands were paralyzed, and more than 3,000 died. Hospitals set up special units with iron lung machines to keep polio victims alive. According to the CDC, approximately 15,000 children and as many as 35 adults annually, totaling over 200 paralyzed children from 1940 to 1945 occurred, and then the polio vaccine was introduced by Dr. Jonas Salk. During those years, 500,000 people died or were paralyzed annually by the polio virus worldwide. We still have polio on Tanna Island where my wife and I do mission work. I still have a few patients in the U.S. that are partially paralyzed from polio even today. Do you know how many school closures due to polio in the decades of the 1940s and 1950s I could find by an internet search? I could only find a few local school closures in Chicago for grade school and Baylor University, and all of those only for a few weeks. Even the parenting guru Benjamin Spock, quoted in the Journal of Pediatrics in 1952, warned against irrational, quote, polio hysteria, end quote. And yet headlines and images of polio victims were familiar features on the front pages of papers through the summer months. American parents were petrified. And in 1952, a survey found that Americans feared only nuclear annihilation more than polio. So why the disparity of what we see now in our generation from what the greatest generation had as far as their response to this? They didn't shut down their society because of something that was just pure evil for children. We seem to have a large part of our populace that's happy to trust and depend upon the federal government to meet its needs, and also to tell them what's right for them. I'm also concerned that there's no longer a real sense of duty or calling to sacrifice for others at such a level that a young and healthy person would risk doing their duty to provide for themselves and their families while carefully protecting the vulnerable as in generations past, but are willing to allow the government to take these responsibilities. Do you know that the risk of dying from coronavirus for a 35-year-old so far is about 1 in a million? That is 100 times less likely than being struck by lightning. Think about it. The risk of being struck by lightning in our lifetime for a 35-year-old or under is 1 in 10,000. A man who went to war from 1941 through 1973 had the chance of losing his life serving his country of 1 in 10. We lost over 500,000 young men in World War II in Vietnam. Serving others costs. Living a life that matters costs.